All right, so welcome to this deep dive, you guys. We're going deep into the world of musculoskeletal medications.
Ooh, love it.
We're going to be looking at your notes from week 2
Okay.
of your licensed vocational nurse course.
Awesome.
And we're basically boiling them down to like the need-to-know info, right?
Yep.
It's like a cheat sheet for when you get out there
Really.
and you're in a healthcare setting and you see these meds.
Yeah.
So let's get started.
Okay, so we're talking about some really fascinating drugs
Yeah.
that can do so much.
Yeah.
Like tame inflammation when it's going crazy, help rebuild bone,
Uh-huh.
even relax those muscles that can make life so miserable.
Totally. So let's start with like the inflammation fighters, right?
Okay.
I see in your notes delimumab and etanercept,
Yeah.
and they're both TNF inhibitors.
Right.
Can you break down for us like what TNF even is and why blocking it is like such a big deal?
Oh, for sure. So think of TNF like tumor necrosis factor. It's this like alarm signal that sets off inflammation in the body.
Gotcha.
It's like calling in the troops when there's a threat, but
Yeah.
sometimes, like with conditions like rheumatoid arthritis or Crohn's disease or even psoriasis,
Right.
those troops end up attacking healthy tissue.
So basically, these drugs are like saying, all right, troops, stand down.
Exactly.
You know, it seems like that could be really powerful
I can.
for these like chronic inflammatory conditions.
Yeah, by blocking that TNF,
Uh-huh.
these medications can seriously help
Yeah.
reduce that inflammation and alleviate symptoms.
So helpful.
But there's a big, but here,
I was going to say, what's the catch?
it's kind of like turning down the volume on your immune system's alarm system.
Oh, so wait.
Yeah.
So they're bringing down the inflammation,
Yeah.
but are they also leaving patients more vulnerable?
Potentially. To infections.
Yeah.
Yeah, that's the trade-off you always have to think about
Yeah.
with these immunosuppressants. They can be so incredibly effective.
hmm
But yeah, they do increase the risk of infections.
Okay. So for a nurse,
Yeah.
what are some like red flags, that you'd be walking out for
Oh, for sure.
in a patient who's on a TNF inhibitor?
Like vigilance is key here, okay?
Okay.
Even a low-grade fever
Yeah.
that might seem super minor in another patient
Right.
could actually be a sign of a really serious infection
Wow.
in someone whose immune system is suppressed.
Okay.
So regular TB screenings are also really essential
Gotcha.
because, TNF inhibitors can reactivate latent TB.
Right.
And then, of course, you want to make sure you have really careful injection site care
Oh, right.
to prevent infections from taking hold.
I'm seeing why they call these medications like double-edged swords.
Totally, totally.
Powerful benefits, but with some serious risks
Yeah.
to manage.
Yeah, it's all about finding that balance.
Yeah,
Which requires, like you said, that careful monitoring
right.
and patient education.
Absolutely. Well, speaking of balance, let's move on to bone health, right?
Yeah.
Because I'm looking at these notes and I see calcitonin,
Huh?
ergocalciferol,
Yep.
ibandronate,
Yeah.
and raloxifene.
Right.
And they all seem to play a role in bone health,
Yeah.
but in like really different ways, right?
Absolutely. It's like having different tools in a toolbox.
Gotcha.
Each one's designed for a specific purpose, right?
Okay.
So like calcitonin,
Yeah.
it's kind of like a brake pedal for bone breakdown.
Okay.
It slows down the activity of those osteoclasts,
Uh-huh.
which are the cells that break down the bone tissue.
I love the brake pedal analogy. That's really good.
Yeah, so it's not actually building new bone.
Right.
It's more about preventing the existing bone
Oh,
from being broken down.
Gotcha. So like in Paget's disease where there's excessive bone breakdown,
Exactly.
that's where this would come in.
Exactly.
Okay. What about ergocalciferol? Where does that fit in?
So that's actually a form of vitamin D,
Okay.
which is super important for calcium absorption.
Gotcha.
So think of it as like the key
Yeah.
that unlocks the door for calcium to enter the bones to make them strong.
Okay.
So if someone has like low calcium levels, hypocalcemia,
Right.
that's where ergocalciferol comes in.
Gotcha. So it's not directly working on the bones,
Right.
but it's providing like the ingredients
Yes,
for that bone strength.
exactly. And then ibandronate.
Yeah.
Now that's a different story.
Okay.
It's a bisphosphonate,
Uh-huh.
and it works by binding to the bone surface,
Okay.
like a sticky note.
A sticky note. I like that.
Yeah, so it sticks to the bone,
Okay.
and that interferes with the osteoclast's ability
I
to
don't know.
break down the bone tissue.
So it's adding like another layer of protection
Totally. Yeah,
to the bones, making them more resistant to breakdown.
that's it.
That's pretty cool.
Yeah.
All right. What about raloxifene?
So raloxifene is cool because it's a SERM,
Okay.
A selective estrogen receptor modulator. It's kind of like a key
Okay.
that fits into some locks but not others.
Right.
So in this case, it mimics estrogen's effects on bone,
Okay.
but it blocks estrogen in other tissues, like the breast.
So it's like getting the benefit of estrogen
Totally.
without the downside.
Exactly.
Okay, so that's pretty clever.
Yeah.
So it's a good option then for preventing osteoporosis.
Yeah, especially in postmenopausal women.
Right.
Yeah.
Okay, so we have a brake pedal, a calcium key, a sticky note, and a selective key.
Love it.
What are some things that a nurse would need to keep in mind
Yeah.
when it comes to patient education for these bone medications?
I think like administration is key, right?
Okay.
So like for the calcitonin nasal spray,
Yeah.
demonstrating the proper technique can make all the difference.
Right.
And how effective it is.
Okay.
And reminding patients to take their calcium and vitamin D supplements.
Right, because even if you're slowing down the breakdown,
Right.
you still need to provide those building blocks for new bone formation.
Yeah.
Okay, cool.
And with ibandronate,
Yeah.
patients really need to understand the importance
Yeah.
of staying upright
Okay.
for at least 30 minutes.
Okay. Why is that?
Because if it like lingers in the esophagus,
Yeah.
it can cause some irritation.
Oh, wow.
So staying upright helps it move down to the stomach quicker,
Gotcha.
and that reduces the risk.
Okay, so it's not just about absorption.
Right.
It's about minimizing the side effects.
Exactly.
Okay, are there any other, like, red flags to watch out for with these?
Well, with bisphosphonates, like ibandronate,
Uh-huh.
there's a rare but serious side effect
Okay.
called osteonecrosis of the jaw.
Wow, okay.
So while it's uncommon,
Yeah.
any jaw pain should be reported right away.
Okay, so noted. It
Hmm.
sounds like with all these medications, really careful monitoring and open communication
Absolutely.
is just essential.
Couldn't agree more.
All right, shifting gears again.
Okay.
Let's talk about that muscle relaxant. That was in your notes, cyclobenzaprine.
Cyclobenzaprine.
What's the lowdown on that one?
Okay, so cyclobenzaprine is interesting
Yeah.
because it doesn't work directly on the muscles.
Oh.
It's more about how the brain perceives those pain signals coming from the muscles.
Okay, so it's not like relaxing the muscle fibers.
Right.
It's more like calming down the signals that are making those muscles spasm.
That's a great way to put it.
Yeah, that's really helpful for those painful muscle spasms. You know, that can happen with injuries
Yeah,
in certain conditions.
for sure.
Okay, cool.
Like turning down the volume on those pain signals.
Yeah.
Right?
Yeah.
So the muscles can relax.
I feel like this is going to be a classic.
Okay.
But it's worth repeating, don't mix this one with alcohol.
Oh, absolutely not.
Right.
Combining them can make you so drowsy
Yeah.
because cyclobenzaprine on its own can cause drowsiness.
Uh-huh.
And then you add alcohol, it just intensifies that. Yeah.
Okay, so monitoring for sedation is definitely key with this one.
For sure.
And I imagine, like, assessing muscle tone
Yeah.
would be important too, right?
Absolutely. You want to make sure those muscles are actually relaxing,
Right.
not just that the patient is feeling sleepy.
Okay, perfect.
Yeah.
All right, let's move on to a hormone that I think most people associate with menopause,
Okay.
but clearly has, like, a lot more going on,
Oh, for sure.
and that is estrogen.
Estrogen.
Right.
It does a lot.
Yeah.
It's definitely a multitasker.
Looking at these notes, I see it's used for, like, menopausal symptoms.
Yep.
Osteoporosis prevention,
Right.
and even, like, as part of hormone replacement therapy.
Exactly. And that's all because of how estrogen interacts
Yeah.
with these different receptors in the body,
Okay.
right? So for those menopausal symptoms,
Mm-hmm.
like hot flashes, vaginal dryness,
Right.
estrogen can help restore that balance.
Okay.
And then for osteoporosis prevention,
Yeah.
it helps maintain that bone density.
Mhm.
And then with hormone replacement therapy,
Yeah.
it helps address a variety of those hormonal imbalances.
Oh, okay, I see.
Yeah.
So that's interesting, but then there's this note about increasing the risk of blood clots.
Right.
And that seems a little counterintuitive to me.
It's true. Estrogen can make the blood more likely to clot.
Okay.
That's why it's so important to choose the right patients
Right.
and to monitor for any signs of clotting,
Ah,
like if their legs swell,
right.
or they have sudden chest pain,
Yeah.
or even severe headaches.
Okay, so it's that balancing act again.
It is
Yeah.
risk assessment
Yeah,
is so important in medicine.
absolutely.
And it's especially important with a hormone like estrogen
Yeah.
that has such big effects on the body.
Okay, well said.
Thank you.
Okay, on to a topic that always needs really careful consideration,
Okay.
and that's pain management.
Right.
Specifically, we're looking at hydrocodone.
Okay. An opioid.
Hydrocodone's really effective.
Yeah.
for pain relief.
But it's a medication that demands respect.
I see that. Opioids have been in the news a lot lately.
Yeah.
And the risks associated with them
For sure.
can't be ignored.
Absolutely.
So we have to approach prescribing opioids with like a heightened awareness of those risks.
Absolutely.
So when is an opioid like this one appropriate, you know? And what are the alternatives that we should be considering first?
That's the million-dollar question.
Yeah.
And unfortunately, there's not an easy answer.
Okay.
It really depends on the individual patient.
Okay.
You know, how severe their pain is,
Right.
what their medical history is like,
Yeah.
and their risk factors for potential complications.
So it's not a first-line treatment?
No, not ideally.
Yeah.
You want to look at all the other options first.
Okay.
So like things like non-opioid pain relievers,
Yeah.
physical therapy,
Okay.
maybe some alternative pain management techniques. And then if those don't work, then you look at an opioid.
Okay, that makes sense. And if we do end up prescribing an opioid, what are the absolute must-dos in terms of monitoring?
So respiratory depression
Yeah.
is a major concern.
Right.
So you have to monitor breathing rate and oxygen saturation.
Okay.
And another common side effect,
Yeah.
which might not seem as serious,
Right.
but it can really affect someone's life,
Yeah.
is constipation.
Right.
So regular bowel function assessments are important.
Okay.
And then, of course, we can't forget about the potential for abuse and addiction.
Right, of course. So it's not just about managing the pain.
Yeah.
It's about managing the whole patient.
Yes, it's a holistic approach. You're thinking about all of it.
Their physical symptoms and their vulnerabilities.
Exactly.
Okay. All right, let's wrap up this section
Okay.
with that last group of medications.
Right.
And that's the immune system modulators.
Okay.
We've got hydroxychloroquine, infliximab, leflunomide, and methotrexate.
Right.
Okay, so these medications, their role is to treat autoimmune diseases.
Right. And it's a really interesting area.
Yeah.
We're talking about fine-tuning the immune response.
It's amazing, you know, looking through these notes.
Yeah.
The range of conditions that these can address is incredible.
Yeah.
Lupus, rheumatoid arthritis, psoriasis, Crohn's,
Right.
even cancer.
Yep.
It's almost like they're like Swiss Army knives of the pharmaceutical world.
They're super versatile,
Right.
but they're also very potent.
Okay.
So with that potency
Uh-huh.
comes the potential for some serious side effects.
Okay, so as a nurse, what are some key side effects to be on the lookout for with these?
So each medication has its own side effect profile,
Okay.
but there are some common threads.
Okay.
So like with hydroxychloroquine,
Yeah.
there's a chance of retinal toxicity,
Okay.
which can damage the eyes.
Wow.
So that's a serious one.
Yeah.
With infliximab.
Yeah. Because it's given intravenously, we need to be on the lookout for those infusion reactions.
Okay, and those reactions, what do those look like?
So they can be mild,
Okay.
like itching or flushing, but they can also be severe,
Okay.
like difficulty breathing
Wow.
or changes in blood pressure.
So close monitoring during and after infusions
Yes, super important.
is essential.
Absolutely.
Okay, what about leflunomide and methotrexate?
So with those two, liver toxicity is a concern.
Okay.
So regular monitoring of liver function tests is key.
Okay.
And then methotrexate can also suppress bone marrow activity,
Okay.
which increases the risk of infection.
So we're back to vigilant monitoring,
No.
regular lab tests,
Yeah.
and really talking to our patients
Oh, sure.
about these side effects.
You want them to feel comfortable
Right.
reporting any unusual symptoms.
This has already been such a deep dive.
I know, right?
We've covered so much ground.
I know, and we haven't even scratched the surface. I know.
But I think it's a really good foundation
Yeah.
for understanding these meds and how they can help people.
We've covered TNF inhibitors, bone medications, muscle relaxants, estrogen, pain management, and even immune system modulators.
And that's just part one.
I know, and we did it all in just part one.
It's amazing how much we can cover
Yeah.
when we just focus and break it down.
Okay, well, let's take a break here
Sounds good.
and come back for part two, where we delve into even more specifics.
Yeah, wait.
Welcome back to our deep dive, you guys. Into musculoskeletal medications, I feel like we've already covered a semester's worth of material.
I know, right?
And we're just getting started, ready to keep going.
Oh, yeah, absolutely. There's still so much to explore.
Okay, so let's zoom in on a few of these medications.
Right.
That really caught my eye. Ibendronate, for example.
Yeah.
It's used to prevent and treat osteoporosis,
Right.
which is a huge concern, especially as people age.
Big time.
My grandmother actually struggled with it.
Oh, I'm sorry to hear that.
So can you tell me more about ibandronate?
Yeah, so it's one of those sticky note medications we talked about.
Right.
A bisphosphonate that sticks to bone surfaces and inhibits that osteoclast activity.
Right, the bone breaking down cells.
Exactly.
But if it's already clinging to the bone, why does someone need to stay upright?
Oh, that's a great question.
For 30 minutes after taking it.
It really shows you that we're always thinking about, both the drug's target and the patient's well-being.
Right.
So in this case, we want ibandronate to get to the bone, but we also want to minimize any esophageal irritation.
Okay.
So staying upright helps move the medication down to the stomach quickly.
Gotcha.
And that reduces that risk.
So it's a simple step.
Totally.
It can really make a big difference.
Huge difference.
For the patient.
Yeah, it reminds me that even with powerful meds,
yeah,
sometimes the most important interventions are the simplest.
Absolutely. Okay, switching gears to infliximab. This one feels like it's in a league of its own.
It is. It's a monoclonal antibody.
Yeah.
And it targets TNF.
Okay.
So it's dialing down that inflammatory response.
Okay, so it's like a more targeted approach.
Yeah, you could say that.
To fighting inflammation. And it's used for some serious conditions too, right?
Oh, yeah, for sure. We're talking Crohn's disease, rheumatoid arthritis, even severe psoriasis.
Wow.
So conditions where the immune system is attacking the body's own tissues.
But if it's suppressing the immune system, are we back to those infection risks?
Absolutely. And with infliximab, because it's given intravenously, we have to be on the lookout for infusion reaction.
Okay, so those reactions, what do they actually look like?
They can be mild, like some itching or flushing.
Okay.
But they can also be severe, like difficulty breathing.
Oh, wow.
Sudden drop in blood pressure, even a sense of doom.
So having a protocol for managing those reactions is crucial.
Absolutely. Knowing the signs, when to stop the infusion,
right,
what meds to give, that can make all the difference.
Being prepared.
For sure.
Okay, putting that on my study list.
Good idea.
What about leflunomide?
Okay, so that one gets into the cellular stuff.
Okay.
It inhibits an enzyme involved in pyrimidine synthesis.
So pyrimidines, those are the building blocks for DNA, right?
Exactly.
So leflunomide is basically stopping those cells from replicating.
You got it. And since those immune cells are constantly dividing, especially with all that inflammation,
right,
leflunomide can really help put the brakes on that.
So it's slowing down the production line
Yep.
of those overactive immune cells? That's smart.
It is pretty clever.
But there was a note about liver toxicity being a side effect. What's that about?
Yeah, liver toxicity is definitely a concern with leflunomide.
Okay.
So monitoring liver function tests is essential.
Okay.
And just as important, we got to teach our patients about signs of liver problems.
Okay, so like what?
Things like jaundice, dark urine, or any persistent abdominal pain.
Okay, so once again, it's empowering patients to be involved in their care.
Absolutely. Open communication is key.
Absolutely. All right, on to methotrexate. Now, this one I've heard of.
Yeah.
But in the context of chemo, how does it work for these conditions?
So methotrexate is another one of those versatile meds.
Okay.
It has a bunch of uses.
Right.
For cancer, it's used at higher doses to kill those rapidly dividing cells.
Right.
But for things like rheumatoid arthritis, it's given at lower doses to suppress the immune response.
So it's like a dimmer switch for the immune system.
I love that analogy.
Yeah.
We can adjust it depending on what we're treating.
But like all powerful tools, it needs to be used carefully.
Oh, for sure.
What are some key side effects to be aware of with this one?
One of the big ones is bone marrow suppression.
Okay.
Which can lead to low red blood cells, white blood cells, and platelets.
So we're looking for signs of anemia, infection, easy bruising.
Exactly. Regular blood tests are crucial.
Okay. Anything else?
Liver toxicity is also a concern, just like with leflunomide.
Right.
And it can cause nausea and mouth sores, too.
Okay, so impacts on the blood, the liver.
Yeah.
Even basic comfort levels.
There's lots to think about.
It is. It really highlights the importance of individualized care.
Couldn't agree more.
You know, it's not just about the drug.
Right.
It's about the person taking the drug.
It's about the whole patient.
Right. Okay, back to that holistic approach.
Always.
All right, ready for a quick change of pace?
Sure, what do you have in mind?
Let's talk about raloxifene.
Okay.
This one's always felt a bit like a puzzle to me.
It's definitely intriguing. It's a selective estrogen receptor modulator.
Right, that's our SERM.
Which means it acts like estrogen in some tissues,
okay,
but blocks its effects in others.
That's where I get tripped up.
Yeah.
How does it know which tissues to act on?
Think of it like this. Our bodies are covered in locks.
Okay.
And hormones are like keys.
Mm-hmm.
Estrogen's like a master key.
Oh.
It can open a lot of different locks.
Right.
But raloxifene is more like a special key.
Okay.
Designed to fit certain locks only.
Gotcha.
So in this case, it fits the locks in bone tissue.
So it's tricking the bone tissue into thinking it's getting estrogen.
Exactly.
Even though it's not. That's really cool.
And the best part
is
that it doesn't fit the locks in breast tissue.
Okay.
So you don't get those same risks as estrogen.
Right. With breast cancer.
Exactly.
That's so clever.
It is. Getting those benefits without some of the downsides.
I feel like there's always got to be some side effects, though, right?
Well, of course, we're always weighing those risks and benefits.
Right.
With raloxifene, some common side effects are hot flashes,
Okay.
leg cramps, and an increased risk of blood clots.
So while it might be a good option,
Yeah.
it's not risk-free.
Right. Careful patient selection is key.
Yeah.
And monitoring is super important.
Okay, I'm starting to see why they call these selective.
They really are.
Yeah.
They target specific things to get specific outcomes.
It's fascinating stuff.
It really is. The more you learn about these meds,
Uh-huh.
the more you realize how complex the body is.
Okay, we've got one more medication
Right.
before we wrap up this part of our deep dive,
Right, Jude.
and that's hydroxychloroquine.
Okay.
Now, this one has been in the news a lot lately,
It has.
so I'm curious to get your take on it.
So it's a med with a long history.
Okay.
It's primarily used as an anti-malarial drug,
Right.
but it also has immunomodulatory effects,
Okay.
which is why it's used for autoimmune diseases like lupus and rheumatoid arthritis.
So it has like a dual identity,
We could say that.
fighting off parasites
Yeah.
and then calming down the immune system.
It reminds us that medications can have many uses,
Yeah.
and their effects can vary
Oh,
depending on the dosage and the condition.
Right. And I remember hearing that its use for autoimmune diseases is considered off-label.
Yes.
In many cases, what does that mean exactly?
So off-label means using a medication
Yeah.
for a purpose that's not specifically approved by the FDA.
Okay.
That doesn't mean it's unsafe or ineffective,
Right.
but there might be less evidence
Gotcha.
to support its use for that particular thing.
Okay. That's good to know.
So being open about that with patients is important.
Yeah. Transparency is key.
Absolutely.
And what about side effects?
Yeah.
What are some things nurses should be watching for?
So one of the most serious is retinal toxicity,
Oh, okay.
which can damage the eyes and lead to vision loss.
Wow.
So regular eye exams are
Yeah.
really important for anyone taking it.
Okay. Are there any other potential side effects?
Yeah, things like nausea,
Mm-hmm.
headaches, skin rash,
Okay.
and like a lot of meds, it can interact with other drugs.
Okay. So always being aware of those potential interactions.
Always looking at the whole patient.
Right. And their whole medication list.
Exactly. It's about putting the piece together
Yeah.
to provide the best care.
This deep dive has really been eye-opening.
It has, hasn't it?
You know,
Yeah.
the complexity of these musculoskeletal medications,
Mm-hmm.
it's not just about memorizing names and dosages.
Right.
It's about understanding how these drugs work,
Yeah,
on a deeper level,
absolutely.
and how to manage both their benefits and their risks.
For sure.
I always learn so much from these deep dives.
Me too.
And I hope our listener is too.
I hope so.
It's amazing what we can
I
learn
know.
from just a few pages of notes.
It's crazy.
And we've still got more to explore.
I know, right?
Can't wait for part 3.
Me neither.
All right, welcome back to our last part of this musculoskeletal medication deep dive. I feel like we've been through a whole pharmacy at this point.
It has been quite a tour, yeah.
Inflammation fighters, bone protectors,
The whole 9 yards.
and everything in between.
And it's amazing. Each medication has so much research behind it.
Yeah,
Development, clinical experience. It's humbling
it really is.
to think of all the effort
Yeah.
that goes into creating these tools for healing.
It makes you realize the responsibility we have,
Totally.
to use these tools wisely.
Absolutely. Knowledge is power.
Yeah.
The more we understand about these medications,
Yeah.
the better decisions we can make for our patients.
So speaking of knowledge, can I pick your brain for a second?
Sure. Go for it.
We've talked a lot about the specific meds, but what about the bigger picture?
Okay.
Like, what are some things beyond medication that play a role in preventing and managing these conditions?
So medications are definitely important,
Yeah.
but they're not the whole story.
Right.
Lifestyle factors are huge.
Okay. Like, what Give me some examples.
So regular exercise is super important.
Okay.
It strengthens muscles, improves flexibility,
Yeah.
keeps those joints moving.
Okay.
And it doesn't have to be crazy intense.
Right.
Even moderate stuff like walking, swimming, gardening.
Right. Finding things people enjoy and can stick with.
Exactly. And diet matters too.
Okay.
Eating a balanced diet, lots of calcium, vitamin D, that can really support bone health and reduce inflammation.
It's not just about what we're prescribing then. It's the lifestyle we're encouraging.
It's about giving patients the power to take care of themselves.
What about things like physical therapy or occupational therapy?
Oh, yeah. Those are often essential.
Yeah.
Physical therapy helps with strength, flexibility, range of motion.
Okay.
And occupational therapy helps people adapt to their limitations and do everyday stuff more easily.
So it's a team effort.
Totally.
Doctors, nurses, therapists, and the patient.
Everyone working together.
All working together for the best outcome.
Collaboration is key. Each person brings something unique.
Right.
And we create a really holistic approach.
I love that perspective.
Yeah.
It's not just about the symptoms. It's about the whole person.
Absolutely. Their physical health, their mental well-being, their support system.
Recognizing that health is multifaceted.
Yes.
And everyone has their own needs and challenges.
Couldn't have said it better myself.
Well, I think we've covered just about everything.
We have, yeah.
Musculoskeletal medications, the specific drugs, the broader context of care.
From how they work on a cellular level to the importance of lifestyle and teamwork.
It's been a journey.
It really has.
I always learn so much from these.
You too.
And I hope our listener does too.
I hope so too.
It's amazing what we can get out of just a few pages of notes.
It really is.
So as we wrap up, I have one question for our listener.
Okay.
Given everything we talked about, what do you think were the biggest challenges for healthcare providers in managing these conditions?
That's a great question. Healthcare is always changing.
Right.
New challenges pop up all the time.
Yeah.
But I think one of the biggest is balancing pain management with the risks of certain medications.
Like opioids.
Especially opioids. Finding that sweet spot.
Yeah.
Relieving pain without causing harm.
And it's not just the meds. It's addressing the underlying cause of the pain.
Totally.
Exploring other options, lifestyle changes.
It's complex, no easy answers.
It's a conversation we need to keep having.
Absolutely. Open minds, compassionate hearts.
Yeah.
And a willingness to learn as things change.
Well said. Thanks for joining me on this deep dive.
My pleasure. I always love these.
It's been great.
Until next time, keep learning and keep diving deep.
And to our listener, thank you for being here with us.
Yes, thank you.
We hope you found this deep dive informative and helpful.
We hope you learned a lot.
Until next time, keep learning, keep exploring, and keep making a difference.
That's what it's all about.